I'm Dr. Opperman. I'm a general practitioner and I have a special interest in aesthetics and anti-aging medication, which incorporates holistic men's health and sexual dysfunction. My interest in testosterone supplementation therapy started when I realized that a lot of the male patients that came into my office were complaining of the same thing. Most of them said that, their mood has changed, their zest for life and sense of general well-being has decreased. Besides the fact that the most significant thing for them was a decrease in sexual appetite and libido and then sexual functioning. They were starting to gain weight in places where they never gained weight before. They were not exercising as well as they used to. They were not performing optimally at the office, and all the younger guys were starting to yap at the heels, for their positions, and they complained about, I've lost that certain something. When I started investigating, I started realizing that what they have in common is a deficiency or lower than normal testosterone level. I started the T clinic with the specific aim to treat the hormone imbalance that starts developing as we are getting older. My main focus for my demographic was supposed to be men between the ages of 50 and over. But I started seeing younger and younger men in my practice coming in with clinically low testosterone levels due to our lifestyle. They are all running around madly, chasing careers, home life, children, trying to balance that with living healthy by being in the gym and being out on the sports field and just not coping with it. It was as if the demands of life were getting the better of them. Once I started supplementing the testosterone, we started seeing such a phenomenal increase in their productivity, increase in their concentration and performance at the office. Their mood started elevating, they were feeling healthy and manly, and for them, all of them reported that their libidos and erectile function and sexual functioning improved, which for me is probably one of the most important things, is that led to better relationships. The patient we're seeing today is Sean Weiner. He's a 43-year-old male patient. He's an executive, a very stressful job. And he presented with me with the main complaint that he has been feeling demotivated and with tendencies to a depressed mood. He has sought professional help in that regard, and everyone else wanted to put him on psychiatric medication for depression and anxiety.
The symptoms that I had were primarily feeling low. I was feeling depressed. I was feeling just serious lack of motivation. Just didn't want to get up in the morning. Also really strange sleep patterns. So I was sleeping really badly at night. I was very tired coming into the day. Obviously these terrible symptoms had an effect on both professional and my personal life.
On presentation, you presented with the following symptoms. The first one that you said to me is that you're feeling low and that your motivation is waned. Where are we now?
Well, I think to start off with, my motivation was so low that I actually thought I was depressed. And coming to you was based on the option of going to a psychologist or a psychiatrist to go on antidepressant.
Testosterone is one of our steroid hormones, and in men, it's the primary sexual hormone. It is responsible for, firstly, the secondary signs of sexual characteristics like hair growth and the development of muscles and our genitalia. But it has so much more wide-ranging effects on every single system in the body, from our mental well-being in the brain to bones, muscles, our cardiovascular system. Testosterone starts decreasing naturally from about the age of about 28. It is something that happens very gradually over time. So the symptoms are mild and often attributed, oh, you're just getting a little bit older. What is important to note is that any adult male can experience what we call hypogonadism. Hypogonadism, low testosterone. You can be 60 with normal testosterone levels and you feel on top of the world. Or you can be 30 with low testosterone levels and feel as if the world is on your shoulders. Once we diagnosed Sean with low testosterone, it was fairly simple to balance, firstly, his elevated insulin levels, which led to his weight gain. He had decreased thyroid function, where I elevated his vitamin D levels, balanced his iron profile so that his thyroid was actually functioning properly, and then started him on testosterone supplementation with an aromatase inhibitor. For simple, to explain that, testosterone in men converts into estrogen.
So the treatment protocol is really injections. It entailed a very strong assessment with Dr. Mark. Blood tests, obviously, to assess where I was from a level perspective. Dr. Mark was very thorough in terms of getting the levels right. And then we started on a weekly treatment protocol of testosterone, which took probably 2 to 3 weeks for me to start feeling the effect of. And I see him every week now. So every week we have an assessment, I have regular blood tests, and we're keeping the levels nice and steady.
Concentration improved, better,
Definitely.
same?
No, concentration's definitely improved. It all kind of rolls up into that kind of feeling depressed, you know, and I think the challenge with the doc was that I didn't know what it was. I literally didn't really care about life. It was and it's been, that for me is probably the most significant change or the biggest benefit that I've received.
Okay. I think any man experiencing the symptoms of, I'm not as good as I used to be, I'm not feeling as great as I used to feel, I'm not performing as well as I used to, I think all of those men should consider having their testosterone levels checked.